So, congratulations, student. Finally, you are in the second year. Now, you are those seniors, bhaiyas and didis. Well, I have a request. Please do not make your juniors' life difficult. They are always already very scared. They are coming from, the preparation of one of the toughest exam in the India. So, be easy on them. They are very good people. Try to be a good friend, a good mentor. So, this is the first lecture of PATHRx. At the PATHRx, we will be teaching you everything from the basics to as much there is to learn from the pathology. All of your references will be from the golden standard books, the love of the pathologist, which is the Robbins. Most of the references will not be from the Robbins basics of pathology, but that would be from the Robbins and Cothran's pathological basis of disease, that mota wala book of Robbins. So, in today's lecture, we will study some basics, the cellular adaptations, we will see certain modifications of the cells and everything. Well, before that, let's understand a few basic things about the pathology. Right, because you will be coming up with different terms like what is etiology, what is pathogenesis, what is clinical picture and everything. So let's look at them one by one. So what is etiology? The term etiology means underlying cause plus the risk factors. Example, there is a disease known as tuberculosis, you all know it. Without studying tuberculosis, no one can pass in India. So what is the etiology of tuberculosis? For the underlying cause, that is your mycobacterium tuberculosis, which you are gonna study in the microbiology. And what is the risk factor? Immunodeficiency, like in AIDS. Besides, what is it? Malnourishment. Why? Because the immunity will be low, because there is no, saturated level of proteins in the body. So your body will not able to produce immunoglobulins, which are the antibodies. So this is etiology, which is the underlying cause and the risk factor. Example for the underlying cause, tuberculosis, MTB, risk factor, immunodeficiency, malnutrition. We will take the template of tuberculosis. Now, what is pathogenesis? The term pathogenesis means mechanism of development and progression of disease. Here we look at step by step a disease develops and it's progressing. Okay. Now the third one is clinical picture. You know what is clinical picture? Clinical picture of features. When you go to the postings, now you are in the second years, when you go to the posting of medicine, you see people come up with various disease and you see they present with certain pictures or the features. Example, cough in tuberculosis patients, hemoptysis. So what is clinical features? Clinical feature is appearance of the disease through signs and symptoms. Okay. Now what is the next terminology? Next terminology is investigation. For example, for the tuberculosis, you will study certain tests. For example, cartridge-based nucleic acid amplification test, acid-fast bacilli culture. So these are the ways of diagnosing a disease. Now, besides investigation, what is management? The term management means regimen and protocols for treatment. Okay, for example, for the tuberculosis, you have RNTCP, which is Revised National Tuberculosis Control Program. Now, what is complication? Complications are the medical problems that develops during treatment. Got it? Complications are the medical problems that develop during the treatment. For example, a category of drug is called as aminoglycosides like amikacin, kanamycin. You will study about them in pharmacology. So there is a drug known as kanamycin. Kanamycin has a side effect that in tuberculosis it can cause permanent hearing loss. So this is a complication of it. Got it? So with this we have completed the basic terminologies. What is etiology? Etiology is the underlying cause and the risk factor. Underlying cause for tuberculosis is bacteria of tuberculosis, Mycobacterium tuberculosis. What is the risk factor of tuberculosis? Immunodeficiency, malnutrition, etc. What is the pathogenesis? Pathogenesis is the mechanism of development and the progression of disease. What is clinical features? Clinical features means the appearance of the disease and the signs and symptoms a patient presents in the clinic. Example, hemoptysis. Hemoptysis means blood in the cough. Besides coughing, etc. What is investigation? Investigation are the ways of diagnosing a disease. For example, for the tuberculosis, we have cartridge-based nucleic acid amplification test or the CBNAT or AFB. There are many ways to diagnose a disease, and for tuberculosis, like you have Mantox, you have a lot of tests for it. Because in India, if you don't know tuberculosis, unfortunately you cannot pass the MBBS, because tuberculosis is one of the most contagious disease and it's highly spread in the India. Almost all of the people are exposed to tuberculosis and Mantox would come positive in a lot of them, but they are in not a disease state, they are in an inert state right now. Now, later we have management, which are the regimen and protocols for the treatment. For example, for the tuberculosis, we have RNTCP. What are the complications? These are the medical problems that develop during the treatment. For example, kanamycin can cause hearing loss. Amikacin can cause paralysis attacks. So these are the complications. Now, these were your basics about the pathology. Now let's start with the first topic, which is cellular adaptations. What is cellular adaptation? Let's see. Suppose you are on Earth, as you are. Now on Earth, you get everything. You get food, you get water, you get oxygen, you get a normal atmospheric pressure and everything. So you have oxygen for your cellular respiration, you have glucose and all those nutrients so that your body can grow properly and work properly. Your kidneys are working properly, your blood is working properly, so there is waste removal, and pressure is also good. So this is an ideal state for the cell or your body. Ideal state for the body. But as you go onto the mountain, what happens? The atmospheric pressure reduces. This percentage of oxygen in the air, it also reduces. So what does your body do? It tries to adapt. So an ideal cell, when it goes into a stressful condition, if that is in a range where the cell can strive by adapting, the cell will try to adapt, and this is known as cellular adaptation. Got it? What is cellular adaptation? This is reversible changes in the cell to cope up with changing environment. For example, when you go to the mountain, what does your body do? It increases the hemoglobin percentage, hemoglobin concentration. For example, normally that is around 12, so it will increase. Besides, your heartbeat will increase. So what are these? These are physiological acclimatization. Similarly, your cells also try to adapt to cope up with the changing environment. However, this is reversible. Once the stress is removed, it will also be removed and it will be reversed. For example, when you are on the mountain, high hemoglobin. When you come down from the mountain, low hemoglobin. So this is reversed. So cellular adaptation are the reversible changes in a cell to cope up with changing environment. Don't worry, this is just an introduction. We will discuss about cellular adaptation in very detail. Now, from the mountain, let's say you went even above, let's say 2 kilometers above. Here the temperature will be very low, can go even in the minus. So your body will try to take some hit. Maybe you will start, maybe you will have frostbites. Well, frostbite are a damage to your cells. So the cell will try to adapt, but when the adaptive capability of the cell reaches its extent, the cell will undergo damage. This is cellular damage. But this damage is also reversible. If you remove the stress, let's say you come from here to here, the damage will be reversed. But if you go, let's say 5 kilometer even above, what will happen? This reversible cell damage will turn into irreversible cellular damage. Got it? Now this time, even if you go back, even if you go and sit in your room, the damage will stay there, and soon when you reach the sun, the cell will die. So there is a normal cell. You throw the stress, the cell tries to adapt. You throw more stress, the cell will undergo reversible cell damage. You throw even more stress, the cell will undergo irreversible cell damage, and soon the cell will die. Here you can see these are the normal cells. This is cellular adaptation by hyperplasia. We will study. This is reversible cell damage. All the protoplasmic modifications are gone. This is irreversible cell damage. Here you can see tissue destruction and healing by fibrosis. What is it? We will study inflammation. And here you can see the cells are dead. So this is a basic template. And in this unit of the cellular adaptation, cell death, we will study everything. Cellular adaptation, a single topic. Reversible and irreversible cell death, single topic. Cell death, single topic. We will see what is apoptosis, what is coagulative necrosis, liquefactive necrosis, fibrinous necrosis, caseous necrosis. What is it? We will study everything separately. For the ideal part, you have already studied this in the school, in your histology, in the biology and cytology. Now, what is cellular adaptation? Let's see. Suppose you are a man and this is a 5 kg rock. Well, you can easily lift it even if you don't go to the gym. But what happens if there are 3 stones of 5 kg? Well, you can do 2 things. You can take out separately, one time one rock, another time another time the third one, or you can call 2 more friends. So here you see there is a stress. The stress is 3 rock. So you also try to adapt and you call 2 more friends. So you increase the number. This is known as hyperplasia. Got it? Hyper means increased, plasia means growth. Now what if the rock is too big? Well, you can call even more friend, or you can go to gym and become more stronger. Here If you have become stronger, you can alone lift the 10 kg dog. Well, what is this? This is hyper means increased, trophy means size. So you increased your body size so that you can take out the stress. This is hypertrophy. But what if the stone is in the water? What will you do? Now you will convert to a fish, go to the water, and you will take it out. What is this? This is metaplasia. Meta means change, growth, and plasia means growth. So a growth in terms of changes. You convert it from a man to a fish. Well, this is hypothetical just to make you understand. Again, this is normal. Well, the stress increased, you increase the number, that is hyperplasia. Well, the stress the stress amplitude increased, you increase the size, that is hypertrophy. Well, the stress changed. Earlier it was in air, now it's in the water, and now this is metaplasia.